So I'm a clinical social worker here in Kittery, and I work with families and individuals and adolescents, and I work with them through a variety of mental health concerns, whether that be eating disorders or anxiety or depression. I also work with people who are just dealing with general stress or life transitions. And I like to work with people in a pretty eclectic way. I don't subscribe to one specific modality. I like to use art, I like to use talk therapy, and to get people in touch with whatever goals they need to accomplish or skills they need to gain to better their life and achieve the goals they want to achieve. So all of us experience some emotions like anxiety or depression, sadness, even attention difficulties. When it becomes a mental health issue is when it happens over time or it gets in the way of psychological, social, or just a functioning that someone has to do on in their daily life. So I like to use the example that sometimes we feel anxious about going to the doctor because we have to get a shot and we don't want to have to get the shot. And that might be anxiety, but it's not the level of anxiety that someone who has an anxiety disorder who feels anxious all the time and has difficulty managing that anxiety. So that's a big difference I think is important to point out. And what contributes to our mental health would be biological factors, social factors, any trauma we've experienced. So it's a variety of things that impact our mental health. If your child does say that they've been maybe struggling with depression or some anxiety or some other sort of mental health concern, it's important not to panic. It's important not to jump in and sort of say, let's fix this, let's do X, Y, and Z. But I think just receive the information, make a calm plan. That might be calling a mental health professional, checking in with the school social worker if there is one, and maybe going to the pediatrician. Again, that can be a really great resource to get a referral and further assessment for your child. If there are stronger concerns of like self-harm or suicidality or substance use or just risky behaviors, maybe the next step could be something a little more intensive. You know, if that is really actively present, maybe doing a mobile crisis evaluation. But generally, I think you can, go to the doctor or call a social worker in the community or a therapist in the community and get the help that you need. Going to therapy can be really intimidating because you're expected to sit across from somebody you've never met before and be really vulnerable, share your emotions, share what's going on for you, and that can be really scary and actually be something that prevents a lot of people from going to see a therapist. I think it's important to know that most therapists are really open, they're really empathetic, their job is to listen, their job is not to judge, and so I think it's important to know that going in, and hopefully that will quell some of the anxiety of going to seek help. I also think it's important to understand that going to therapy is going to be different for each person, and it's going to be different based on the therapist and type of counselor you see. So I think it's important to read profiles online, ask good questions when you go about how the therapist sees change or how the therapist works with individuals. I also think it's important to know that you can stop working with a therapist at any time. I think some people feel like they're tied in because they've started, and just like a hairdresser, you can find a new hairdresser any day you want, just like you can find a new therapist. So I think those are really important things to remember as you go and seek help, is that most therapists are very empathetic. They really want to help you. They really want to listen. They're not judgmental, and you're kind of in the power seat, and you can make the change to either continue to see the therapist or find somebody new. One thing that I hope parents take away from this conversation is that adolescence in 2018 is very complicated and very challenging. Young people have a lot of pressures on them, whether that be school pressures or social pressures, and I think we need a community of adults who are knowledgeable and have an understanding of mental health and be willing to talk about it with young people, be willing to listen to young people, and be educated on the resources that will provide help for not only the kids, but also them themselves. So I think it's important to take that away and to know that it's okay to seek help. The resources are available, and it can really make a big change.